So lipids are actually a major risk factor for cardiovascular disease, right? And here we are just trying to make the link much more clearer to students, all right? Because everybody out there should know that lipids, all right? And when we talk about lipids being a risk factor for cardiovascular disease, we're actually looking at the low density lipoproteins or any other lipoproteins that it is not high density lipoproteins. So collectively, we call them non-high density lipoproteins. Okay, so let's have the lecture, which you guys should get to understand the concept better. So plasma lipoproteins levels are major modifiable risk factors for cardiovascular disease. Modifiable risk factors in the sense that if you correct your lifestyle, probably you are eating foods that are rich in all these low density lipoproteins. If you correct your lifestyle, you correct the problem that you're having, okay? So they are modifiable. So increased levels of these low density lipoproteins and other lipoproteins fractions that are not high density lipoproteins contribute to the development of what? Atherosclerosis. This is what? An atherosclerotic plaque. Now this atherosclerosis is what? The buildup of fat on the walls of what? The blood vessel, right? So these high density lipoproteins are associated with what? Lower risks of atherosclerosis and heart disease. This is because they take cholesterol from the cells or tissues and move it to the liver. While these other lipoproteins, they actually deposit cholesterol in the cell. That's why there's what? Deposition of cholesterol in this tissue, right? So if you have a large amount of these low density lipoproteins, you have possibility of developing this disease condition, all right? So following chemical modifications such as what? Oxidation, the ApoB lipoproteins are no longer cleared by normal mechanisms, all right? So they become inflamed and they cause atherosclerosis. These ApoB lipoproteins, they are the ones that actually form these low density lipoproteins, okay? So they trigger a self-perpetuating what? Inflammatory response, during which they are taken up by macrophages to form the foam cells, which are a hallmark of what? Atherosclerotic lesions. Low levels of these high density lipoproteins in the body are often associated with what? Triglyceride elevations. So as the high density lipoproteins that we say that they are good, as their levels are getting low in the body, triglyceride levels are what? Shooting up. Okay, so I think we missed a slide here. All the non-high density lipoproteins are lipoproteins that are not high density lipoproteins. They consist of all cholesterols like what? Very low density lipoproteins, IDLs, low density lipoproteins, okay? And they are carried within a lipoprotein fraction that are what? Atherogenic. They can cause problems to the what? Vasculature, all right? So this is just an overview of lipids as a risk factor for cardiovascular disease. I could just get to see that lipids that will actually mean is any lipids that is not high density lipoproteins. That's it.